everyone, welcome back. Anna here with the Coding Guild. Hope you are having a great day. Today's video is going to be centered around the question so many are having. Do you need separate courses to be able to pass the certification exam for both of these CDI credentials? Or could you get away with your current knowledge if you already hold one of them? The answer will depend on your professional experience, so let's see how these credentials measure up, and then you can decide whether you need additional training or not. We will review the similarities and differences between these credentials, some topics that fall in between, and additional miscellaneous items to consider. Let's start with the similarities. Both the CDEO and the CDEI test on general CDI knowledge and concepts, such as the purpose of clinical documentation improvement, medical record expectations, medical necessity, the benefits and best practices of CDI, how to establish a CDI program, provider education, financial impact of documentation quality, and the query process. They are also comparable when it comes to basic compliance and documentation standards. We have to know what HIPAA is, what its parts are, the minimum necessary standard, documentation types and components, signature requirements, electronic health record pitfalls such as cloning, macros or copy-paste, abbreviations, data governance, etc. And last but not least, some legal and oversight-related knowledge is also transferable between the two credentials. They share the topics of HIPAA enforcement, the offices of the OIG, OIG work plan, compliance program guidance, federal regulations such as the False Claims Act, the types of federal audits, fraud, waste and abuse, and related penalties. Knowing these foundational topics of CDI will earn you 25 correct answers on the CDEO under 3 different exam domains. Unfortunately, I don't have information on how relevant these basic topics are on the CDEI because at the time of creating this video, the CDEI exam breakdown is not yet public. Please check the official AAPC website for further information and possible updates on this. Link in the description. Right, now let's see the bad news. How different are these credentials? The main difference between the CDEO and CDEI is that they are dealing with different provider types and places of service. The CDEO focuses on outpatient profit coding and billing, while the CDEI is mainly concerned with inpatient facility compliance and revenue cycle. For starters, it means that they are using different code sets. Diagnosis coding is the same, but for procedures, the CDEO uses CPT and HCPCS codes, and the CDEI has ICD-10 PCS codes. Now, technically, you could get away with not knowing how to code procedures because these are not coding exams, but it would be unwise to try because procedure codes are not only for coding, they are also an essential part of the payment methodologies these credentials test for. On the CDEO, we have to understand the fee-for-service payment model and its associated concepts, the relative value units, the 3 parts of NCCI consisting of the procedure-to-procedure edits, the medically unlikely edits, and the add-on code edits. We have to be able to correctly apply global days, use the obstetrical package, CPT and HCPCS modifiers, understand bundling, and everything in between. For the CDEI, we need different DRG payment methodologies such as MSDRGs and APR-DRGs. We need to understand the financial effects of transfers and readmissions. We also need to know how long-term care reimbursement works, what a case mix index is, and just in general, how the inpatient prospective payment system works. As you can tell, these are very different areas of knowledge and not really readily portable between the two credentials. For most of these topics, you can find dedicated videos on my channel, link in the description below. The same is true for quality measures. The CDEO tests at a minimum on CMS star ratings, HEDIS measures, the quality payment program, and meaning for use, while the CDEI reviews the hospital value-based purchasing program, patient safety and quality indicators, and hospital-acquired conditions, in addition to the star ratings, just to name a few. Again, quite the difference. Next, we have those items that are included for both credentials but are still substantially different. Both exams test ICD-10-CM coding and guidelines, but the CDEO focuses on outpatient coding, sections 1 and 4, and the CDEI deals with inpatient coding, sections 1, 2, 3, 4, and appendix 1. The documentation types to be reviewed are also different. Due to the place of service, the CDEO mainly has office visits, ancillary procedures, minor office procedures, preventive medicine, counseling, and in general, just a ton of evaluation and management documentation types. In contrast, the CDEI reviews inpatient EM visits, complex surgical, diagnostic, and therapeutic procedure notes, discharge summaries, postoperative observation notes, ED and ambulatory chart requirements, and the like. Third, we have providers. Provider types and the services they perform greatly influence what CDI professionals need to know. For outpatient services, we have to look at Incident to guidelines, supervision requirements and their compliant documentation standards, and teaching rules, amongst others. For inpatient services, we also have the need for teaching physician guidelines, also for split, shared visits, assistant surgeon documentation requirements, obstetrical delivery notes, and other specialized provider documentation. Finally, some additional aspects to consider if you are getting ready for either or both of these exams. The CDEO explores risk adjustment coding, payment models, HCCs, and the necessary documentation in place to justify payment under these models. It reviews MACRA and MIPS, corporate integrity agreements, and the requirements for a compliant advance beneficiary notice or ABN. The CDEI has more complex cases with longer, more involved documentation to review. To be successful in these reviews, we need very strong knowledge of clinical indicators, pathophysiology of diseases, and pharmacology. In short, this credential, the CDEI, is way more medical than its outpatient counterpart. So, what do you think? Is your current knowledge enough to take the other credential? Let me know in the comments below. For now, I would like to thank you for being here with me today. I will see you soon in our next video.